Good morning! Good morning sa lahat! Kumusta ang araw? Kumusta ang buhay-buhay? Dito tayo ngayon sa part 2 ng ating Health, Well-being, and Illness. Chapter 3 na to ng libro Dr. Alice Woman's Health Bible. So, Paul's diagnosis. Wait, kung meron pala kayong suggestion or any ano kung mga topics na gusto niyong basahin ko. So para magkaroon ako ng idea kung ano yung next na libro na magandang basahin. Just let me know. Paul's diagnosis. Until the mid-1930s, most physicians were taught and used Paul's diagnosis. Today, it is a forgotten art. We have been using this pulse diagnosis for over 20 years and having mastered the art to some degree. I am teaching doctors to use it in their practices. They have been astonished to observe how the nature of the pulse changes in women who are pregnant or menstruating or ovulating, going through premenstrual tension or anemic. If the pulse indicates the stage of the menstrual cycle and uterine function, the body must be going through other changes too. The reproductive cycle is not isolated. The respiratory, digestive, hormonal, renal, circulatory, metabolic, and emotional functions are deeply involved, and any abnormality is bound to be reflected in the function of the entire body and mind. Some symptoms which can only be assessed subjectively, such as fatigue, lack of concentration, emotional changes, memory loss, or sleep disturbances, are open rows of as mental condition by physician, yet they form part and parcel of the reproductive cycle. The time of the month. Even though menstruation is a normal psychological occurrence, it puts the body's energy reserve and healing power under some strain. Too often, women concentrate on the practicalities such as hygiene and totally ignore the implication it has on their wider health. It is a misconception that you lost a lot of blood during normal menstruation. So, hindi pala yan totoo. Only about 40 to 50 ml of blood is lost. And endometrial cells, example, from the lining of the uterus, constitute the rest. The sloughing of endometrial tissue is gradual, which is why menstruation usually lasts 3 to 5 days, but can be up to a week. Menstrual blood should be dark red in color, but without pieces of dark brown clots. It has a strong odor because, unlike fresh blood, it is not flowing directly from veins or arteries. It also contains dead tissues from the endometrium that has begun to necrotize or die back a few days before. Necrotize. Symptoms accompanying menstruation can be minimal or profound. 2 or 3 days bedridden with migraine or period pains more severe than labor pains. Conventional medicine treats these debilitating conditions symptomatically, regarding them as hormonal problem even after blood tests reveal normal hormone levels. And in most cases, when progesterone is administered, there is no improvement. It is obvious that we have to look for the answer elsewhere. Cosset yourself 40 to 50 ml. Ito 100 ml to eh. So kung normal menstruation, then ito lang yung lumalabas sa usual. Ito yung normal. Half nito. Cosset yourself. Advertisement for tampons and sanitary pads stress the ability to be carefree during periods. But in fact, these days are exactly when you do need to care for yourself. Although the loss of blood is not great, the days around the start of a period may bring on discomfort or pain, difficult mood swings, and you may feel generally drained. Not without reason is a common expression for the menstrual period, the course. In India, women were traditionally exempt from praying, going to temples, cooking, carrying babies, carrying water pitchers, meeting too many people, and so on for the first 3 days of their periods. Mm. The use of cosmetics, massage, swimming, shouting, sitting in strong wind, listening to loud music, arguing, and standing for long hours were also not recommended. The use of cosmetics and sexual contact or even arousal was not permitted. In modern times, such precautions are hard to take. There is no provision in the employment law to take time off during these critical days. And generally, women want to be discreet about their periods. Things that help. A light, easily digestible diet to avoid straining your body and sapping energy. Homemade chicken soup, fish, chicken, eggs, soaked almonds, carrots, and apple juice, pomegranate, raw salad, potatoes, rice, pasta, and green vegetables are all good. Warm shower or a bath once or twice a day if possible. Personal hygiene at this time is very important. Oh, pero dito sa atin sa Philippines, may nakakausap ako na hindi talaga siya ideal maligo. Pero dito naman nakalagay warm shower. Kasi na-try ko na siya na hindi maligo whole na period ng whole duration ng period ko. Ang ganda ng ng result niya kasi purely blood lang talaga ang lumalabas. Wala siyang mas sinasabing na may mga clot, may mga something ganun, yung mga blood clot na parang tingin natin parang blood clot siya. Yung parang apple-apple dito yung sinasabi, apple-apple. Wala siya. Nung ginawa ko yung hindi naligo, hindi naman in a way na hindi naligo talaga. Yung bang parang punas sa amin dito eh. Yung parang hilamos. In a way, yung parang yung cloth niya, sinok ko lang siya sa warm water. Yung parang lukewarm. Ano. Tapos, yun na yung pinanglinis ko sa katawan. Nakakatulong siya. Para sa akin yun yung na-observe ko nung sinimulan ko na ganun yung gawin. Pero dito, warm shower. Warm shower or a bath once or twice a day if possible. Personal hygiene at this time is very important. A good fluid intake, 2 liters of water a day. This, such as fennel, menther vessel, can help you relax, especially if they are made from fresh leaves. Boil herbs leaves for 2 to 3 minutes and ordinary tea leaves if wish. Strain and add honey to taste. Relaxation. Tension, both physical and mental, exacerbates symptoms and stress is likely to be magnified by the hormonal changes your body is undergoing. Even if you don't actually suffer from PMS, So stretch out and rest whenever you can. Listen to quiet music and do anything that will keep you feeling calm. Multi drinks are relaxing, and some people believe that even wearing certain colors such as white, lilac, pink, and turquoise can lift your mood. Controlled breathing. If your periods naturally tend to be heavy, you may need to take a day or two off as part of sick leave or unpaid leave. Consult your GP if this becomes a long term problem. Anything strenuous, long hours at a computer, carrying, lifting, and standing for a long time becomes a great strain and it's not advisable. Breathing exercise. Spending a minute or two on this every couple of hours or so helps to calm the mind and oxygenates the blood better. Loosen your clothing and lie comfortably on your back. Breathe in slowly and deeply over 3 seconds, blowing out your abdomen as you do so. This may be the opposite of what you usually do as you inhale. So ito yung breathing exercise na tinuturo niya. Trinay ko siya. Madali siyang gawin pag iniisip mong nagpapalubo ka ng balon sa tiyan. Parang yung pag-inhale mo, yung pag-inhale mo kasi kailangan mo, yung usual, inhale, papasok yung abdomen natin eh. Yun napapansin ko. Pero yung nang time na trinay ko siya, pag nag-i-inhale ako, ganon. Pero yung hindi ganon. Iniisip ko, habang nakahiga ako, iniisip ko siya na nagpapalubo ako ng tiyan. Ganun. Tapos yung palabas ko naman, parang inisip ko naman na pinipisa ko yung yung balon. Parang ganun ang iniisip ko sa mind. Try nyo din kung ano yung yung pwede sa inyo. Hold your breath for a further 3 seconds and then slowly breath out over 6 seconds, sucking in your abdomen as you do so. Repeat 10 times. 10 times pala yun. Sige, balikan ko. Things that don't help. Food that is heavy to digest. Fried food, sausage, bacon, butter, curries, chilies, red meat, offal. Citrus, fruit, ice cream, chilled drink, ice cubes. Oh, hindi pala siya ideal, no? Yung mga ganong food. Smoking, coffee, alcohol, tight-fitting clothes, traveling, general stress at work and home, irregular hours. Sex. This is a tricky time for women. The neck of the uterus is dilated to facilitate the menstrual flow, which increases the chance of infection reaching the uterus. Sexual contact or even excitement or arousal also puts a lot of strain on a woman's body. For couples who are used to regular lovemaking, abstaining for a week may create tension. The matter gets worse if you have PMS for a week, when you may not wish to be touched, and then you have another week of abstinence. Exciting yourself for your partner's sake is not a good idea. And if you have the space, it may be easier to sleep in a separate room for these days. Talk this through together to avoid misunderstanding. Men can often take personally a refusal or lack of interest in sex. Your period is the end of one cycle, but also the beginning of the next. As soon as the endometrium has shed its old lining, it begins to rebuild a new one. To be prepared if a fertilized egg should arrive. These rebuilding cells, this rebuilding calls for a blood supply and for you to supply good quality raw materials through, not the ends. Period pains. This is the most uncomfortable symptoms of period. periods. Sometimes the pain is so severe that women pass out, and as many as 20% of girls take time off school because of period pains. Although this is a difficult statistic to ascertain. Buti na lang hindi ko talaga ito na-try, yung mag-absent ng during sa school time, tapos meron. Pains usually last for 1 or 2 days before and during the period and vary both in intensity and type. Ganun siya kahirap, you know. Some women experience a dull, nagging ache in the abdomen and lower back. Others have sharp cramping and tenderness across the lower abdomen. For others, the pain is colicky. Colic, col, colicky. Clicky, coming in and going in waves. These different types of pain have different causes. Misaligned uterus. The uterus is held in suspension by ligaments, sometimes either due to nutrition or genetic predisposition. These ligaments are not strong enough, and the uterus is tilted too far either forwards or backward. This results in the formation of a kick in or near the neck of the uterus. At the beginning of a period, the blood cannot pass easily past this kick, so the uterus begin to contract as if in labor to force the menstrual flow on its way. This is when intense waves of pain start. This type of period pain is debilitating, and even strong painkillers do not help. But it stops suddenly as soon as the blood has been expelled beyond the kink. 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 Such period pains most commonly start in late adolescence. The, contras- the contraceptive pill is frequently prescribed to control the pains, but it won't help if the problem is structural. Childbirth often realigns the uterus, which is why when periods start again, they often come without pain. So yun nga siguro, no? Childbirth often realigns the uterus, which is why when period starts again, the open come without pain. Sore abdominal tendons. So ito yung mga reasons pala ng bakit may mga period pains. Misaligned uterus, sore abdominal tendons. Another source of pain is the tendons that attach the lower ends of the abdominal muscles to the pubic bone. These tendons can get inflamed and sore from excessive exercise of certain sort, sit-ups, weights, riding a bicycle, kickboxing, step machine, or from increased pressure on them from weight gain, or an abdomen bloated from pelvic congestion just before a period. The result is severe lower abdominal pain until the period starts. So, hindi siya ma-ideal ang excessive exercise talaga. Treatments. Pain from whatever source will be exacerbated by strain and tension. Follow the general advice for during period. Stick to food that easy to digest. So, yung sa mga period ng pain, nakakatulong tong yung mga sa warm shower, good fluid intake, relaxation, and controlled breathing. Yung pag inhale, exhale. Mm. Inhale, exhale, inhale, exhale. Hindi siya mas dali gawin sa Tinatry ko ngayon, hindi siya madaling gawin pag nakaupo. Mas idea siya nakatayo, nakahiga talaga. Tapos doon mo siya parang pinupalubo yung tiyan mo habang nag inhale ka. pinipisa mo naman siya, parang yung ginaano mo, squeeze mo naman siya pag ano. Mhm. Stick to food that is easy to digest and is particular steer clear of everything on the things that don't help list. High stomach acid may affect the collagen in tendons and ligaments. So if your lower abdomen is tender, avoid citrus fruits. Easing easing cramps. When the cramps start, massage the area just above the pubic bone using peppermint balm, which is especially soothing. Tiger balm, or simply olive or sesame oil. Massage gently and then with a slight pressure. This relieves the soreness in tendons in this area. The result can be dramatic. Unexpected pain. If you suddenly experience period pains when you have not had them in the past, they may be a symptoms of an infection of the uterus lining or irritation caused by, for example, an intrauterine device contraceptive coil. This should be checked out straight away by your GP or clinic. Turn position. Drink multi-drinks and calming herbal tea with honey. Try chamomile or peppermint. Avoid very cold drinks. A pain relieving poultice. Heat 1 cup of salt in a pan for 5 minutes or so. 1 cup of salt. 1 cup of salt in a pan for 5 minutes or so. Pour the salt in the center of a tea towel or square of cloth. Tie it up to make a poultice. Wrap in another layer and the contents are too hot. Dab this hot poultice on the lower part of your abdomen, particularly just above the pubic bone. Do this for 5 minutes or so 3 times a day to make the poultice even more potent. Add 1 teaspoon of mustard seeds or thyme and heat together with the salt. Supplements. Homeopathic remedies can be helpful. Pulsatilla 30. Suck 2 tablets 3 times a day. Begin 2 days before the expected start of your period and continue for the first day of 2 of your period. Do this for 3 or 4 cycles to get result. May mga supplement siyang Paul, Pulsatel, 30. Tapos isa din ito na food supplement, Veladona. Meron ba dito sa atin ito? Sa Pinas? It's not until you fall that you fly when you're 30. Belladonna 30. Suck 2 tablets every 2 hours while the cramps continue. Suck 2 tablets every 2 hours while the cramps continue. Excessive bleeding. Menorrhagia. Ito yan siya. Excessive bleeding. No. Kung tama pagkabasa. Menor. Menorrhagia. Menorrhagia. Excessive bleeding. Some women have natural light periods while others regularly lose much more blood but still fall within the range of what is considered normal. Very heavy or prolonged periods over more than 7 days, which may be characterized by gushing and clots, indicates the uterus is continuing to bleed after it has done its normal shedding of the blood engorged endometrium. This extra blood loss can be debilitating causing anemia, headaches, dizziness, fatigue, and fainting. The cause may be a chronic and perhaps undetected condition such as fibroids or endometriosis, or it may be brought on by the fitting of an IUD contraceptive coil. An unusual excessive period may be a symptoms of a tumor or a prolapsed uterus or even a miscarriage and should always be investigated. Treatment. If no specific cause has been diagnosed, the bleeding over and above the usual menstrual blood has to be stopped. Do not work or carry anything heavy. Bed rest helps and you should move only when absolutely necessary. Ice packs on the lower abdomen will help contract the uterus and staunch the flow. Compensate for the loss of blood with a highly nutritious diet to help the blood regenerate as soon as possible. Eat plenty of protein such as meat and poultry. Vegetarians should eat eggs. Vegans should get as much as protein as possible from soaked almonds, other high protein nuts such as cashews and peanuts. Choose unsalted ones, soya products, and ghee. Anong ano to? Ghee na product. Ghee. Have 2 cups a day of homemade chicken stock. Other good source of blood synthesizing elements are organic kelp or chicken liver and pomegranate. Juice carrot and red apple with a little root ginger help to tune up the body and prevent low blood pressure and consequent fatigue. Ah, carrots. Carrots and red apple. Supplement. Yung mga supplement niya is Sapari Pack, an Ayurvedic supplement made from betel nuts, help the uterine wall to contract gently. This squeezes the numerous blood vessels that penetrate the muscular uterine wall, allowing the blood to clot. Lachesis 30 and Sepia 30. Take alternatively every 2 hours or as recommended by a homeopath, illustrating the homeopathic principle of treating like with like. Lachesis is a snake venom that causes hemor- hemorrhaging, but in minute homeopathic doses it has the opposite effect. Indian Onani remedies such as bandage co are also very effective if you can take them under appropriate medical supervision. Meron para sa mga Indian bandage, bandage, bandage ko. Yung kanina is excessive bleeding. Ito naman is scanty period. Scanty period. Or sinasabi nila sa ano is oligomenorrhea. Menorrhea. Scanty period. This is a pattern of periods when they are over 35 days apart and less than 3 days in duration. If you think it unlikely you have reached the menopause, although this can be premature, such as light periods, may be an indication of poor nutrition, lack of ovulation, or polycystic ovaries. Treatments. Follow dietary advice in the lifestyle program and ensure you are getting plenty of proteins. Vegans in particular, or teenage girls who are eating too little in an effort to lose weight can be missing out on vital nutrients. Include in your diet pomegranate, rhubarb, yam, or avocado. Check your diet is not low in fat-soluble vitamins. This help with hormonal regulation, particularly vitamin E in its natural form. Rich sources are with germ, vegetable oils, nuts, and seeds. Fresh aloe vera can be beneficial. Stress can have an adverse effect on your periods, and for this, I advise neck and shoulder massage at least 2 10 minutes session a week at home or professionally 3 times a month. Acupuncture, therapeutic yoga for stress management and to improve the functioning of the pituitary. Sometimes the pill can be helpful in regulating periods. Supplement, shatavari, donghu, and agnos castus, together with Mexican yam. These are estrogen and progesterone mimics. What I prescribe is to take shatavari 1 tablet twice a day, donghu 1 tablet a day, and agnos castus 10 drops for 15 days after the end of your period. Then take a capsule of Mexican yam until your next period starts. This way you will take no supplement during the periods. Phytoestrogens. These are several available. Consult an integrated medical physician or qualified herbalist. Several homeopathic remedies are beneficial. Consult a qualified homeopathic. Ito naman is ano, lack of periods. Lack of periods or ito yung tinatawag na amenorrhea. 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 Double R. Ah. Amenorrhea. Roya. My lack of periods. Amenorrhea. Your periods naturally stop when you become pregnant or reach the menopause, but other factors can cause them to dry up in a woman whose menstruation has previously been normal. When this absence of period extends to 6 months or more, it is termed secondary amenorrhea. Primary amenorrhea, rhoea, indicates that menstruation has never started. Almost all women can ovulate by stimulating with drugs, but not all can conceive, especially without proper period. So, a lack of period is a major worry for those who want to have children. Mm. Almost all women can ovulate by stimulation with drugs, but not all can conceive, especially without proper periods. So, a lack of periods is a major worry for those who want to have children. Nutritional deficiency, severe weight loss, excessive exercise, and a sudden trauma can all cause period to cease, especially when they affect the balance of one or more reproductive hormones. Disorders such as anemia and Crohn's disease causing diarrhea and nutritional imbalance can also result in cessation of periods. So man, naman,
ko dili nakuha. Na mag-ice na. Nakapatay ka ng kuan? Tag-as nga kuan? Tag-as?
Hugas na.
Sarap yan.
Na.
Ito na, anay. Pwede mo lang, iba ko dili lang mo itarget ang ilalo.
Isa ka bo?
Okay.
Wala sila, ano na, itagom dyan daw haon. Wala pa po. Manawag pa ko kay ano, manon sa nako ni. So, diet and exercise. Crash diet, anorexia, or being markedly underweight from illness or stress can result in the loss of period. Very restrictive diet, especially if avoiding animal protein or any sort of fats, can cause a deficiency of the fat-soluble vitamins A, D, E, and K. Vitamin E is very important for women, and if the body is short of essential fats, particularly cholesterol, the synthesis of estrogen is affected. Lack of iron, resulting in anemia and very low blood pressures, makes the body sluggish and it will attempt to protect itself from any blood loss. Anemic conditions also affect the function of the pituitary gland, which triggers certain hormonal secretion. Many high-level sportswomen, exercise instructor, ballerinas, and women involved in heavy physical work find their periods stop at times of intense training because, as a result of building up muscle bulk, the adrenal gland secretes steroids that are similar to male hormones in nature. Hmm? Mm-mm. Ha? Isa? Oo. Ha? Unsa man? Di man sakto sa imuha. Di man sakto sa imuha iyang gamit. May man siya. Kahit JR raman jud ka. Ang kuan ba kuya mo? Kuya po ni asikaso. Mo gani asa naman ang code? Mo gani asa na gani? Kay gina-follow up na gani niya. Send lang gud sa ano, picture no nimo na ano nara. Lang. Hormonal imbalance, physical trauma, head injury, whiplash, even excessive dental work or a complication that dates back to birth, forceps, venous delivery, etc., can reduce the blood flow through the vertebral arteries in the neck. This can impair the performance of the pituitary hypothalamic area of the brain, vital to hormone secretion. Severe stress, bereavement, illness, divorce, major financial difficulties can cause the adrenal glands to be overstimulated and the pituitary to be exhausted. Stress hormones, adrenaline, noradrenaline, are like androgens, male hormones in nature, and so can interfere with normal female cycles. A poorly functioning thyroid. A poorly functioning thyroid a pituitary tumor, or certain drugs such as dopamine antagonists can cause an increase in prolactin levels. Prolactin is the hormone that triggers breast milk production and so overrides the usual hormonal signals that control ovulation and menstruation. Some scientists believe that leptin, the hormone that controls weight gain, plays an important role in regulating menstruation. They argue that anorexic do not menstruate because leptin production is low. When they gain weight, their periods return. My personal view is that this is primarily a matter of nutritional imbalance. Disease. Polycystic ovary symptoms. Polycystic ovary syndromes is often characterized by menstrual irregularities. The liver metabolizes estrogen and is instrumental in the conversion of excess androgens, male hormones, to oestrogens, a relative of estrogen. Liver disease such as hepatitis and psoriasis can interfere with this process, resulting in too many male hormones in the body. Disorders that affect the digestion and absorption of nutrients, such as anemia, ulcerative colitis, and Crohn's diseases, and result in dramatic weight loss, are often accompanied by loss of period. Treatment. Whatever the root cause, amenorrhea is usually symptomatic of a nutritional or hormonal imbalance, or often both interlinked. The sooner you start treatment, the better the results are. Do not wait for 6 months for your doctor to confirm the diagnosis of amenorrhea. If you do not have periods for 2 months and are not pregnant or menopausal, or do something about it. This integrate treatment plan of diet, massage, relaxation, and supplement has helped many women with secondary amenorrhea and some with primary amenorrhea. Nutrition. A high protein diet is essential. Eat eggs, fish, poultry, and lean meat. Vegetable proteins are not so effective in this treatment plan. Oh, mag-matter din talaga siya sa ano eh. Imagine mo, vegetable proteins are not so effective in this treatment plan. To kickstart periods, you need more than cottage cheese, soya products such as tofu, and nuts and lentils. Take folic acid and iron as well as multivitamins and minerals as general supplement. Pomegranates, apple, cherries, yam, yogurt, avocado, and nuts, especially almond, pistachios, Brussels nuts, and hazelnuts, all provide vitamins and minerals helpful to restoring menstruation. Massage. The massage session of the Lifetime program explain how neck and shoulder massage are effective in enhancing the function of the hypothalamus and pituitary. Have this treatment every other day if you have a willing partner, or else once a week by a trained massage therapist. Relaxation. Try to minimize your stress level. Resulting outside stresses may take a long time, but relaxation techniques will help you cope better with them. Yoga, meditation, and simply setting aside time for yourself to be quiet and perhaps listen to specially recorded tapes or CDs are all useful. Supplement. Zinc. 1 15 milligrams tablet every day for 2 months. Bili pala ng zinc. Shatavari, 1 tablet twice daily. Dunkel, 1 tablet daily. In Agnus Castus, 10 to 15 grams daily for the first half of the calendar month. Then Mexican yam, 1 capsule twice daily. And Shatavari, 1 tablet daily for the second half of the calendar month. This alternating pattern of estrogen mimics is the first half of the month, and then progesterone mimics in the second half can help trigger the return of periods. Aloe vera, 1 capsule twice daily, or 1 teaspoonful of fresh gel or pulp. Do not take the latter if you are pregnant or think you may be. Other aids, acupuncture and homeopathy are useful in treatment secondary ammonia. acupuncture. Very short cycle. Ito naman yung lock, pero ito very short cycles. Very short. Very short cycles. Polymenorrhea. Polymenorrhea. Periods that occur more frequently than about every 25 days are usually due to lack of ovulation. If ovulation does not occur, then there is no need for the endometrium to grow, so it just breaks down. Treatment. Regular neck and shoulder massage helps to improve the functions of the pituitary gland. Homeopathy and acupuncture are also very helpful. Supplement. Shatavari contains natural phytoestrogen, which helps with menstrual function. Aloe vera capsules taken twice daily is a useful remedy. Dong Quai is a useful Chinese remedy. Irregular periods. So ito naman ang tawag irregular. Irregular periods. So, ang tawag naman nito is menometro. Menorrhagia. Menometro. Sometimes bleeding occurs at irregular intervals and the duration and amount can also vary. Periods appear to be all over the place and their very cyclical nature ceases to exist. Because this indicates bleeding from a cause in addition to menstruation, you must get this investigated to rule out anything such as tumor or an undiagnosed pregnancy that has gone wrong. When everything seems normal, doctors usually prescribe contraceptive pills to regulate the cycle. The hormones in the pill take over and the body's own hormones become ineffective. Unpredictable periods cause a lot of stress as their onset can be sudden and sometimes embarrassing. So the artificial cycle helps to bring in some law and order that provides relief. Treatments. When no cause has been found, I recommend the following: neck and shoulder massage, very important. Plenty of protein such as meat and poultry. Vegetarians should eat eggs. Vegans should get as much as protein as possible from soaked almonds and other high protein nuts. Cashews and peanuts are the highest. Soya products in G. Supari pack as soon as bleeding start or take it for 3 cycles continuously. This Ayurvedic medicine helps stop uterine bleeding by encouraging the uterine wall to contract gently. This squeezes the numerous blood vessels that penetrate the muscular uterine wall, allowing the blood to clot. Vigorous gym exercise, aerobics, light weights, and swimming. The natural stir that intense exercise relieves helps to slow down bleeding, the same mechanism that causes scanty or missing periods in the smart sportswoman in heavy training. Bleeding between periods. Ang dami palang ano no? Babantayan sa klase ng pag-bleed. Bleeding between. Meron din palang ganito. Periods. Bleeding between periods. Metrorrhagia. Metrorrhagia. One A one-off occasion of bleeding between periods is not a cause for concern, but if it repeats itself during the next cycle, you need to get it investigated. Consult a gynecologist to identify the cause and get treatment. This type of bleeding is not connected to menstruation and polyps, endometriosis, and erosions of the cervix are all possible causes in cancer. Hormone replacement therapy can also lead to this type of bleeding at times. Treatments. If no cause has been found after investigation and the bleeding continues regularly, then follow the advice for excessive bleeding. So, iba-ibang klase. One, two, bleeding between periods, irregular periods, very short cycles, yung, ito na yun, very short cycle, polymonorrhea, amenorrhea. So, we're done with the periods. Meron pang mga scanty periods and excessive bleeding. So, mas ideal pala kung i-observe mo talaga, i-observe natin talaga yung ano natin, kung anong klaseng bleeding yung ano, nangyayari sa sarili natin para maging healthy tayo. So, yun lang yun muna sa ngayon. Try to check, try ko check yung ano. Maganda pa rin talaga pag ano, meron pala talagang ano, yung sa neck, no? Ganda ng gawin. Saka yung acupuncture. Matry ko nga yung acupuncture din para ma-relax yung body, para healthy always. So that's all. And good morning. God bless everyone. Bye-bye.